With a healthcare debate raging on, Swamp Watch takes on the insurance companies. Shockingly, they are even worse than you feared. That's next. Over the past 2 weeks, as the Republicans have failed to agree on a replacement for Obamacare, we've been focusing on something the whole country should be able to agree on, that healthcare in America costs too much. And the main reason for that is the corruption in the health swamp. First, we exposed how pharmaceutical companies game the system through lies, lobbying and fraud. Then we exposed how mega hospitals and their administrators enrich themselves by squeezing out competition that could deliver better patient care. Tonight, we'll take a look at the health insurance companies and their swampy behavior. They're the target of tonight's Swamp Watch. Everyone can see that health insurance is a sprawling, wildly expensive and inefficient industry that hits you with high premiums, deductibles and co-pays. A 2014 survey compared the US's healthcare system with those of 10 other developed nations and found that although the US has the most expensive healthcare system in the world, we rank lowest amongst those rich countries in terms of efficiency, fairness and actual health outcomes. At the heart of the problem is the vast bureaucracy of the health insurance industry. Some conservatives still talk fondly about free market healthcare and consumer choice, about how you'd never want socialized medicine. There's only one problem. America has got socialized medicine today. Not just Medicare and Medicaid, literally run by the government, which account for nearly half the country, but the private insurance companies too. They're basically private sector bureaucracies, facing barely any competition and depending on the government for their income. Of course, these companies are making a killing. The so-called Big Five, Aetna, Anthem, Cigna, Humana and United Health Group, collectively made $4.5 billion in net earnings in just the first 3 months of 2017. How do they keep the money flowing? By making sure the rules are rigged in their favor. The industry handed out over $15 million in political donations to members of Congress during the 2016 election cycle. Of course, they even handed in their bribery, splitting the cash between both parties. But they especially like giving to politicians who sit on key subcommittees that affect their industry. Senator Todd Young got $224,000 from the industry during the 2016 cycle. He sits on the Senate Committee on Health, Education, Labor and Pensions. His fellow committee member, Senator Pat Toomey, got $190,000 from health insurers. And their Democratic colleague, Senator Ron Wyden, got $186,000. He sits on the Finance Committee's subcommittee on health care. With elected officials of both parties accepting large donations, whether we have Obamacare or a GOP plan, the health insurance companies win either way. Their donations to Max Baucus, the Democrat in charge of the Obamacare legislation, were a particularly good investment. What better way to increase your revenue than to get the federal government to force consumers to buy your product through the individual mandate? Nice work there by Liz Fowler, who you met in our Focus on Pharmaceuticals a couple of weeks ago. As you'll recall, she was instrumental in drafting Obamacare and went on to become head of global health policy at drug company Johnson & Johnson. But what was her role in this swamp before Congress and pharmaceuticals? Vice President of Public Policy at WellPoint, the country's second largest private insurance company. Marilyn Taverner is another example of someone who's passed through the revolving door between the government and the health insurance industry. She's the current president and CEO of the industry's trade association, known as America's Health Insurance Plans. But before she started advocating for the industry, she was the director of the Center for Medicare and Medicaid Services, or CMS, where she turned 2.3% plan cuts into 3.3% increases in the Medicare Advantage program, directly benefiting the industry she now represents. And before her job with the federal government, turns out she was an executive at the Hospital Corporation of America. That's right, the same HCA run by now Governor Rick Scott that we profiled last week and that was hit with the largest fraud settlement in U.S. history. And there are other swamp things crawling out right behind her. Marilyn Taverner's replacement at the Center for Medicare and Medicaid Services is yet another citizen of the swamp, Andy Slavitt. He was previously a top executive at a subsidiary of United Health Group, America's biggest health insurance company, which received $30 billion in revenue from CVS. And Slavitt, when he became deputy administrator, made at least $4.8 million in tax-free income from major healthcare companies. How convenient, then, that acting administrator Slavitt ruled on business that could affect United Health Group. Lobbying and political donations keep the health swamp going. To his credit, Republican Congressman Tom Garrett has tried to expose this corruption. Talking about why nothing ever happens to clamp down on the health insurance companies, he wrote, "So why hasn't it been done? I can think of one sad but logical reason: money and special interests. The donations and lobbying efforts of entities like Humana and Cigna, Kaiser and WellPoint are massive." This is a sitting congressman telling you that the health insurance industry, not our elected officials, are driving health policy. One of the reforms the congressman is pushing for would expose the health insurance companies to real competition. Right now, that's blocked by the little-known McCarran-Ferguson Antitrust Act of 1945. Yes, the government specifically exempts health insurance from most federal antitrust laws. In effect, this means that markets are artificially restricted and that we have what the congressman calls government-sanctioned oligopolies in health insurance. Now, since their business is effectively guaranteed by the government, since the health insurance companies are pretty much part of the government, do their bosses pay themselves like the public sector bureaucrats they basically are? What do you think? Here's a comparison for you. Tom Price, the Health and Human Services Secretary, makes $207,800 a year. The head of Humana, Bruce Broussard, made $17 million in 2016. Stephen Hemsley, CEO of United Health, made $33 million. But the swampy jackpot goes to the head of Aetna, Mark Bertoli, who last year made more than $41 million. As I've said before, I don't begrudge people high salaries if they create value in the marketplace, but these people are just ripping us off. They bribe the government to force out competition and force people to buy their products. That's not the free market. That's not consumer choice. That is a racket. And none of them, not a single one, should be paid a cent more than Tom Price. It's time for a revolution in healthcare, to take on the corruption that enriches the pharmaceutical industry, the hospital industry, and the health insurance industry, while your healthcare costs just go up and up and up. It is time to drain this sickening swamp.